This is LiveWell Talk on COVID-19 weekly update for April 17th. This recording is occurring at approximately 9 a.m. in the morning. We've traversed another week of the COVID-19 pandemic, and at the close of the week, we have 280 cases in Linn County with 22 deaths. A significant majority of those deaths, I believe 21 of them, are attributed to a singular nursing home. And given the pattern that we've observed of recent, it is obvious that social distancing is working. And let me draw that analogy or observation from the following. The clusters or the outbreaks have occurred in a nursing home, now 2 separate packing plants. And just imagine if we didn't have social distancing, you'd have multiple nursing homes, multiple packing plants, schools, Targets, other churches, other areas where people congregate in large numbers and have subsequent breakouts from that. So the social distance is working and our healthcare system remains operational at the highest level. Our critical care resources are in what we call category green, as well as the blood supply. But I would like to talk about what it's going to take to get back to normal operations. This is a decision that will have to be multifactorial and made with the entire community in mind. Our guiding principles for engagement for this pandemic as a medical staff was the following: minimize transmission reduction, reduce morbidity and mortality, preserve a functioning healthcare system, and protect patients, staff, and fellow physicians. So that's why we suspended elective procedures or postponed them, because they do consume personal protective equipment. In addition, having people come to the hospital for non-urgent conditions would expose people to the contagion, and we tried to reduce that. So if those are the reasons why we suspended that, what would be the metrics or the thresholds we need to cross to be able to return to some degree of normalcy? And I think that's rapid testing. I think the ability to test people for the virus, whether it's active infection or past infection, would need to be present and be very robust with a quick turnaround time. That would allow us to segregate COVID negative or past COVID patients away from the other patients that might be positive. And then we could return to normalcy as far as surgical procedures, because we wouldn't be worried about consuming the vast amounts of personal protective equipment is required when taking care of the COVID-19 patient. Other good news is coming out. The more we learn about this virus, I think from experience, we're learning how well our intensivists and hospitals are doing taking care of these patients with a mortality rate of less than 1% if you extrapolate it out to a larger population at this time. The data that came out of Italy, augmented with some of the data that's coming out of New York, I think we have a good treatment plan that is solid for these patients, and we're intervening appropriately, which I congratulate the doctors and nurses and respiratory therapists for all their hard work. I cannot offer the date on which this pandemic will conclude, but I can offer the following: we will be busy, we will work hard, and we'll get through this. For the most up-to-date information on COVID-19, visit our website at unionpoint.org or the Centers for Disease Control and Prevention website at cdc.gov. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unionpoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.